Welcome to the Ovarian Cancer Canada's Advocacy Speaking Up for Your Care and Finances conference call. And we'll now turn the conference over to Ms. Fran Turner, National Program Director. Please go ahead, ma'am.
Thank you. Ovarian Cancer Canada welcomes you today to the third session in our new telephone education series for women with ovarian cancer and their caregivers. Today's program is entitled Advocacy Speaking Up for Your Care and Finances. I know that today's speakers will provide you with helpful and very interesting information about communicating with your health team and the impact an illness like ovarian cancer has on your financial situation. I'm Fran Turner, National Program Director of Ovarian Cancer Canada. Ovarian Cancer Canada endeavors to provide women with ovarian cancer and their caregivers information that they need, and I hope that you will find this session informative and that it addresses your questions. I also want to let you know that Ovarian Cancer Canada has two sessions coming in the new year that are definite. On January 15th, the session will be Sexuality, Intimacy, and Ovarian Cancer. It features Dr. Ann Katz, a sex therapist and a clinical nurse specialist from Cancer Care Manitoba. And on February 7th, Alternative Therapies and Ovarian Cancer. This session will feature Tracy Truant, a nurse researcher with the BC Cancer Agency who investigates the use of complementary alternative therapies by cancer patients, and Dr. Cheryl Proctor, a naturopath who specializes in women's health. In Advocacy, Speaking Up for Your Care and Finances, our three speakers will give their presentation, and then members of the audience will have an opportunity to ask questions. Our three speakers, first will be Linda Tyre. She was a trained nurse and early on made a transition into human resource management and conflict management and adult education. Since 1999, she's been a patient representative for the Alberta Cancer Board, where she has used her adult education skills in developing initiatives that reduce patient concerns. From 1995 to present, her personal goal has been to change the climate at the Alberta Cancer Board to one of care, respect, and dignity. As a faculty member of the Institute for Healthcare Communication, she offers 3 levels of staff communication training, including training physicians and residents. Right now, she's working on her 3rd level of certification from the Society for Healthcare Consumer Advocacy, which is a program of the American Hospital Association. Our second panel presenter is Mary Klassen. Mary has been a registered nurse for 31 years in a variety of settings, and her most recent nursing role has been in occupational health. In the years that nurses were being downsized, she supplemented her income by becoming a private investigator for disability insurance benefits. This led to a stint with the Saskatchewan Workers' Compensation Board. Her background in assisting injured health employees through the disability process paved the way to her position with the Saskatchewan Division of the Canadian Cancer Society as their first client advocate. And our third speaker on our panel is Pamela Bowes. Pamela is the Director of Support for Lupus Canada and is a facilitator with Wellspring Cancer Support Program in Toronto. At Wellspring, she facilitates the Money Matters program, which helps clients to navigate the maze of government income programs and supports for people leaving work due to their cancer diagnosis. At Lupus Canada, Pamela writes several resource fact sheets on government programs and updates on new developments and changes. Pamela has also contributed a chapter to our Ovarian Cancer Canada resource book, You Are Not Alone, for women diagnosed with ovarian cancer. And so we'll be starting off with Linda Tyre. Linda.
Thank you, Fran, for those kind words. I'm going to focus today on 2 areas that I feel are crucial for patients and family members to understand. One of them is communication, and one of them is the second opinion. And just to give you an example, many patients want to take alternative therapy, and they do. They do, especially when they're on chemotherapy, because to keep their immune system up, And if you ask your oncologist, I want to take so-and-so and so-and-so, what's your opinion? They'll probably tell you it's a waste of time or it's a waste of your money. So I always suggest to patients, it's the wording. If you word your question in this manner, will what I want to take, and name what you want to take, interfere with the treatment plan you're recommending? Because that's what it is all about. Some alternative therapy does interfere with the chemo that you're receiving, and others doesn't. So you have to be clear on that, but it's the way you ask the question. So in the healthcare system that we live in today, all of us, every one of us, has to be our own advocate or an advocate for a family member. The old adage of saying no news is good news, don't pay attention, not the answer you need today. If you were told, for example, a referral has been made, ask when the appointment will be made. For example, a number of times I get calls from patients saying, the appointment office has asked me to call you, the patient representative, because I've been waiting 3 weeks for you to call me with an appointment. On investigation, I find out the referring physician hasn't sent a referral, not even yet, but has been telling the patient when they've been calling their office that a referral has been sent. So you need to be on the ball here, on top of the concern. Sometimes you feel, I don't want to bother people, they're all busy. Yes, that's true, but things get lost, they get delayed, and it's your health, and it's your health that's been affected by a delay. Understand what your caregivers or your providers are telling you in clear, concise language. You need to know what the diagnosis is. What is the prognosis of your illness? And what is the follow-up care? And know why you're having these tests done and treatments. You're not being nosy. You're trying to understand. Also, you need to know, is there a risk for what's happening? And I know sometimes patients tell me that they feel that they get pressure to sign consent forms. But please make sure you understand to your satisfaction what this consent form is all about and what you're signing. And with cancer, there is always the clinical trials. And if you feel that maybe I don't want to do this, just really assess what it's all about. Because even if you start a clinical trial, it's your choice. You can refuse further treatment. You'll be discouraged, but it's always the patient's choice to refuse treatment. But you need to know what ramifications that is if you stop treatment. Ask questions till you really understand what's going on. I can't stress that enough. Somebody says, oh, well, the doctor's got their hand on the doorknob. They're wanting to leave the room. You need to really be assertive at this time, or somebody with you be assertive. If you're wanting to get information from the wild world of the website or the internet, find out a reliable resource. There's people out there, and not always is the oncologist, your doctor, the best one to ask about these sites. If you have a cancer society in your area, or you have a cancer information center in your treatment facility, find out. They're usually good resources for you. And not to forget the family doctor. The family doctor is a good resource, although patients say, well, they're not the cancer doctor and they don't know anything about cancer. Well, they may tell you that, but they also do get copies of all your communication. Everything that is on your chart in the cancer facility is on record with your family doctor. Now, I know across Canada it may vary. There may be a little cost or something. So look into some of this, getting your reports. But I always suggest to patients, get copies of your reports. And they'll say to me, but I don't understand them, Linda. Well, maybe you don't. But family and talking things over, then you can form your questions that you want to ask the next time you go for a visit.